Everybody, welcome. Thank you for taking the time during a Eurovision night. I know it's very hard to let go of the Eurovision, but again, Iceland didn't make it, so at least that's not such a bad thing. We've been trying to get more of these meetups going, where we are starting to have some conversation, and the format has changed a little bit. We're going to do a fireside interview. And I'll just ask each of you to introduce yourself and say a little bit about your background, what do you do, and then we'll jump a little bit into the technology and health part. Tryggvi, go for it.
Thanks. So I'm Tryggvi Þorgeirsson. I'm a medical doctor. My specialty is disease prevention and health promotion. I founded a company in 2013 called Sidekick Health, a health tech company, and we basically have a digital health platform to support lifestyle change. We do it to prevent diabetes and also for diabetes management, and also working with employers for employee wellness.
Elvar?
So my name is Elvar. I'm a CEO of Reon, which is a security-driven development company, software development company. We have been working a little bit with personal data and bringing that data into the user's hands, so bringing it back from the corporations and into the user's hands, doing a few projects of that. So,
okay, my name is Ingi, Steinar, Ingason, and I work for the Directorate of Health in Iceland as a team leader for national e-health projects. That means I'm in charge of developing a lot of software for the healthcare system, including e-prescription gateway that you use if you go to the pharmacy, and also a national patient portal where you can actually get access to some of your patient records, data, and you can also do use some online services, book online, and do all sorts of things.
Wonderful. Thank you all for coming, and I was going to kick this off by asking one simple question. Maybe you can start. How do you think the new technology is impacting what you do? You write software, and I'm pretty sure you've been writing software for a while. Now that software is in everybody's hands, we have a supercomputer in our hand, how that has changed how you look at what you do?
Actually I haven't done any programming myself in 15 years or so I'm really not doing that anymore. I'm just arguing at meetings and working with other companies. But we have a huge problem in front of us in healthcare. I mean, population is getting older, and we have all these challenges that we need to work on, and I think technology will actually play a big role in solving these problems and making people more part of their own treatment, more responsible for their own treatment. And I think that technology is actually the way to get people to both get them to do it, but also the means to communicate with the population. I mean, we are developing, for example, solutions that, for example, for blood pressure treatment. So you can actually go home and you can just register your own blood pressure, and a nurse or a doctor at the healthcare center can actually monitor thousands of people.
Oh, wow.
At the same time, without actually calling anyone or meeting anyone. So they can just see the measurements flowing in, and they will get flagged if they're too high, and things like that. So it's going to change a lot.
Yeah. Tryggvi, you are a medical doctor, and of course, what is interesting to me is that you decided to do a startup and not go into the medical profession, or not that you're not practicing, I'm just saying you have a startup, and I work with a lot of startup founders. If you're doing a startup, then you don't have a life. Pretty much your startup is the life. So tell me a little bit about why you decided to make that choice.
Good question. My background, before I went into medicine, I had done some studies in engineering. I had always been fascinated by science and technology, but I decided I wanted to work with patients, help them improve their health. So I did, 6 years of med school, did my internship, started my residency, worked with thousands of patients with lifestyle diseases, and it was just obvious, after the first few hundred, I guess, that we were doing something wrong. We were working downstream, just peddling medicine for conditions that were really due to lifestyle conditions. And I mean, it's evident 80% of our healthcare costs are due to lifestyle-related chronic diseases.
Right.
So I wanted to work upstream. So back in 2010, I took a break from clinical practice for a bit, went to Boston. I studied public health with a focus on disease prevention. And there I got into touch with people at MIT who were using smart technology. At that time it was really emerging. And as you said, it was obvious that having a supercomputer on your person was just going to radically change how we can interact with patients, especially with lifestyle change where as a doctor you sit there for 15 minutes, you can recommend that someone changes their behavior, but that's not going to stick. For lifestyle change you have to have multiple interactions, ideally every day, month after month after month. So smartphones just opened up that avenue. So that's, back in 2012, 13, this was what my passion became.
Okay.
So from there, so that's when I founded the company.
So it really didn't change why you went into medical care, but now it's just having a much bigger impact.
Absolutely, that's just allowing me to work upstream, basically doing what I was doing or wanted to do, but just with using technology to both help me work upstream and scalably.
Right.
So for example, in Iceland you have probably around 100,000 people either at high risk for diabetes or already with type 2 diabetes. I'm not going to tackle that with one-on-one sessions talking about healthy diet and physical activity.
I will probably, just for context, tell a short story, and it's probably personal, but I think most people know about it. Whoever's read my blog, probably 2 people who read the blog every day. I was diagnosed with diabetes about 11 years back, before I came to Iceland. And then I asked my doctor in the US, I said, okay, what should I do? He said, well, lose some weight, change your lifestyle, see what happens. I did that. Of course, coming to Iceland was easier because I was eating much more healthier food than I was when I was traveling in the US. And then I started running marathons, so I immediately lost some weight, and my blood sugar was back to normal. In 2015, it came back with a vengeance. My endocrinologist as well as my cardiologist called me and said, your blood pressure and all that is fine, but your blood sugar is way out of whack. And I hadn't changed anything for 9 years. I still ran, I still ate the food that I ate. And I went to the doctor and said, well, please explain to me, why is this happening? Can somebody say, why do I have diabetes? Because I'm not obese, I run marathons, I don't understand. They were like, we don't know, it could be because it could be genetic. And I was like, well, I mean, genetic should have probably shown up sometime back. It doesn't show so late in my career. And they said, no, just take a pill. Just take one pill, and you can take this pill for the rest of your life, and your diabetes is gone. I said, I don't want to take a pill without knowing why I'm taking the pill. So I did my own research, and I did. Of course, I use technology, and for everybody, it's Google. I just searched, and I found a paper that was written by 2 doctors in Johns Hopkins on a cross-sectional, cross-racial study, and they found that there was a gene mutation for Southeast Asians. I mean, it was actually unfair for me to expect an Icelandic doctor to know about my gene condition, but still, hey, he's a doctor. But long story short, I was able to find what was wrong. I just changed my food habits and diet and everything else, and sure enough, my blood sugar was back to normal without taking any pill. And then I got one of these things, and I monitor my, heart rate on a regular basis, and I monitor my own blood pressure. And sure enough, my endocrinologist still thinks that I'm a crazy person to not take the drug, and I'm like, well, there's no symptoms of it. So that also motivated me to have this meetup and kind of think about technology and healthcare related to startup, because I think a lot of us, for whatever reason, believe our healthcare is our doctor's problem. We have some symptoms and then you show it, and then, like a magician, they gotta fix it. But they see you for a few minutes, there's no way for them to know what's going on. So with that context, I want to come to Elvar. You're building a couple of apps in the health space, and you guys are experts in the technology side.
Yep.
And you interact with some of the providers and healthcare professionals and so on and so forth. How has that interaction been? How do you see the gap between what technology can do and what their understanding of what technology can do?
I think it comes into this self-monitoring aspect of this. Once you have a lot of people, using, if you look at what both Facebook, Google, Apple, and all of these providers have been doing, they've been building their own, like when you buy an iPhone, you get a built-in healthcare app with it. So they're pushing for you to start logging your activities, your medical records, your heart rate, everything. And when you have all of this data flowing around, it has to lead to something bigger, some advances, because you have much more data to work with. So I think there are going to be a lot of changes in the next few years, just because of this fact. What we're working on now is we're working with a company in the UK, which is allowing people to gather their own personal data and keep it in a safe space on their device, on their platform of their own choosings, in order to push for people to be more aware of the data they have. And because right now, Facebook probably knew that you had diabetes before you did.
Yep.
And
probably.
Google did as well.
Yeah.
But if you have that data, it's much easier for you to identify what's wrong with you and
bad for me that I've become Facebook ad blind. So maybe they were sending me some ads about my healthcare and I was just ignoring it. Maybe I should pay more attention.
Yeah, but there's a great example of just Walmart. There was a 16-year-old girl who frequently shopped at Walmart with her parents' card. And then they started receiving flyers and ads with all these baby products. And she's 16, she's an only child, and Walmart somehow knew that she was going to have somebody in that family was going to have a baby, just because of how they're spending habits, what they're buying.
Yeah. Okay.
This is quite a few years back. So the big companies have these things figured out. I think it's moving more towards being user-centered.
And the girl was pregnant, wasn't she?
Yeah, she was pregnant. Yeah. The parents found out.
Yeah.
When the diapers showed up, at least the flyer for diapers. So Tryggvi, I wanted to come to your app, and one of the things that I found interesting was you're using a lot of the terminologies not many medical doctors use, which is big data, AI, behavioral economics, and so on and so forth.
Right.
So I want to get a little bit background into that. What are you doing with that, and how do you think it's going to help me? So I have a Sidekick app, and I use it, and the only problem is that I'm not very good at putting it in, but it keeps reminding me, saying, hey, I think you should take a breather, I think you should do yoga, and I'm like, I'm going to do it when I get my time. But tell me about the big data, AI, and other things that you're using.
Okay, so if I start with the data and how we use that. So first of all, most of what I'm describing is how we use for basically patients who are in our predefined programs.
Oh, okay.
So for example, we work in the US in what's called the US National Diabetes Prevention Program, where so basically 1 in 3 adults are pre-diabetic at high risk of diabetes, and you can identify them with simple ways. And once they are identified, they can enter the National Diabetes Prevention Program, and we service companies that offer that. And once you are in our program, usually a year-long program, we will then create a designed kind of personalized program for you. So, which both leads you through the necessary steps in improving diet, increasing physical activity and such. But we also learn about how active you are, what's your favorite activities, and we push those to you. Just like, as I see it, it's just like Spotify, they just want you to listen more. I just want you to do more healthy activities. So I mean, Spotify isn't going to be pushing jazz songs to you if you hate jazz.
Yeah.
So it's just about learning about your background and using that intelligently. So we now have a database with well over 1 million activities that have been done on the platform. And for each activity we have dozens of background variables. So for example, we can see, okay, for a 2-mile walk, we can see it was done by a 65-year-old woman in Boston, 6 p.m. In January. It was raining outside. She has high levels of stress and she's an introvert. We have all that data, and so for each of those 1 million plus exercises and those additional data points, we feed that into prediction models that learn. And so next, when that 65-year-old woman is going to do an exercise, maybe in February, in similar circumstances, the model will know what she's likely to want to do at that particular time of day. And also if there's another lady that might be similar, so basically just personalizing the recommendations. And I think that's going to have a big impact. And I mean, that's one of the reasons we do have very high activity and high retention, is that we aren't pushing jazz songs to people who hate jazz, basically. And it's the same as Netflix, Spotify. And on that note, and your story is actually a really interesting example of what's one of the exciting future directions of medicine is what's called P4 medicine. Okay. Sometimes also called precision medicine. So P4 medicine stands. So the first P is for predictive medicine, or prediction. So in your case, had you had genomic scan, you might have known that you had these risk factors for diabetes. So that's the prediction part. And for us, we do that through, we can screen you with simple questionnaires. We can screen your risk for diabetes and other conditions. So that's the prediction part. The next P is prevention. So once we do know, like in your case, if we had found when you were 25 that you had a risk for diabetes, we would have put you into the diabetes prevention program then. Then the third factor is personalization, which is what I just described. I would recommend things that you were likely to do, just to get you more active. And then the fourth part is participation, or basically just patient engagement, or what you described as being active in your own health, not just asking your doctor for a pill, or it's participatory. That was the word I was looking for. Being actively engaged in your own treatment.
I mean, we're going to switch gears a little bit on the Directorate of Health side. We hear a lot about cost of healthcare, and we hear a lot of media chatter about how healthcare is going down, and of course everybody has an opinion on it, and I want to hear from somebody who is in the inside, what is your opinion about these discussions? This is just to set the context. What we're seeing in broader trend in all other places, when technology permeates into any business, the cost goes down, the convenience and value starts going up. Whereas in the case of healthcare, it seems to be the opposite. And I want to understand what is going on inside this machine that we're not getting, or what is that I'm not understanding?
Well, big questions. I think I'll leave the political discussions to my boss. You probably heard he's been talking in the news for the last few days, and I think I'll leave that to him.
Yeah.
And he has his opinions on how healthcare is working in Iceland and what should be fixed, and how to fix some of the things. The doctors don't all agree. Yeah. So it's going to be a struggle, but it's I can take one example of how we can really help healthcare with technology. I had a meeting with a doctor at Landlæknirsembættið a few weeks ago, and I was explaining to him how he could use our portal to get requests for drug renewals. And he said after a while I was explaining how he would use it and how the patient would use it and all that. And after a while he said, that's going to save me a lot of time. Probably 8 hours. I was just, what, 8 hours a month or a year or what? No, a week.
Wow.
Just one extra day of work for one doctor at Landspítalann. I mean, that's going to change a lot of things.
Right.
And it's not even sophisticated technology. It's just using web things and then some.
Mm-hmm.
I mean, it's no rocket science,
Mm-hmm.
but it's a lot of low-hanging fruits
Mm-hmm.
still in the healthcare system, and we haven't been investing enough
Mm-hmm.
in technology in the healthcare sector, and I mean, the reason I'm here, I really think we need more startups and people like you working here in the healthcare system, and we shouldn't be using I mean, I get a lot of answers when I go to talk to doctors. Why do you do things like this? It's always been done like this.
Yes.
So it's, usually a lot of the answers are like that. They're not really thinking how we can change and use things that are more modern. And a colleague of mine that graduated from the university 24 years ago with me, he went to work for a private company. And after 3 years, he had completely computerized everything there. It's a transport company. Even the forklift drivers had handheld watches, and this is like 20 years ago. But this has never been done in the healthcare sector. I mean, we are shuffling, even though we have a lot of patient records electronically, we're still pushing a lot of paper. People are running around looking for things, and we haven't really streamlined anything yet.
Yeah.
I don't necessarily think it's the lack of, like you said, it's not lack of technology. Technology exists, and it isn't complex technology needed to be done. It's more of a mindset, and it's more of a, I wouldn't even say it's a political issue. Like, for example, we don't have a unified health registry in Iceland. You got data spread around different databases in different places.
There are some reasons for
it
that.
has some reasons. I know there's
but it's all connected now. Actually, if you go to one doctor in Akureyri and he does some things for you, and then you go to the emergency ward in Reykjavik, they will be able to see everything the doctor in Akureyri did.
This
so
is something
it's
like
all interconnected, and the healthcare network is actually connecting everything. So it's there is one computer system used in all the healthcare sector, all the government-run institutions. So this makes things easier for us, than it's easier for us than in many other countries. They have to have all these standards and things, but we can just in one day decide to do a lot of things.
I've always felt that if there was any place where we could possibly do this quickly, that would be Iceland. And that you have a question?
Well, a little remark on that. I know in Holland they've been trying to introduce a system like that, an integrated system where doctors and but there's a lot of resistance against that. Because patients are, your information goes into this system. It's basically a very big honeypot for insurers might want to know, are you insurable? Do we want to have you? Can we make money off you, or are you going to cost us money? And so how do you control in a system like that who has access to your data? Can I as a client of that system, can I find out who has had access to my data over the last year?
Yeah. You can actually, the law here in regarding patient records in Iceland is quite clear on this. You have the right to get full access to all your patient record data. You can actually get a copy to take home and read, or if that makes your day. But it's a lot of, and you can also get the logs. So everything, all the lookups in patient records are leave a fingerprint. So you can get a log, a nurse on that ward at 7:53 opened this part of my patient record, saw my drugs, and you can even see all the if there was a filter in the system. So that nurse only saw like the last 3 days or last 3 weeks. you can see that was what the filter was applied. But it's of course a complex system. I mean, we have probably around 12,000 people working in the government-run the healthcare system in Iceland. That excludes all the others that are dentists and all that. But it's the law says that if a healthcare provider is actually working for you, he can access all your data. And that only excludes what is called sensitive data. So some you can decide even for yourself if you want some data to be marked as sensitive, or even some departments in hospitals can be marked sensitive. So everything that is registered there is not accessible for people from another institution. But we have a lot of user groups, and some people see a lot of data, some see very limited amount of data. But but you in our portal you will soon see the list of everyone that's been looking you up.
So you're basically working on providing easy access for the consumer to.
Yeah, and we're actually thinking as the patient is actually the best person to monitor who is accessing his data. I mean, he knows where he was. I mean, it's very difficult for us at the Directorate, for example, to see, oh, there was a nurse in Akureyri looking up this person's data. We don't know if you were there. It's really difficult, but you will know. Yeah. Hopefully you know.
Well, you also know, I mean, if you haven't left Reykjavik for a year, then and somebody in Akureyri has been looking up your data, then something's up.
Yeah, but it can have actually good reasons. There could be a specialist in Akureyri, and you went to a doctor here, and he actually wanted to get a consult from that person. Yeah. So it could have normal reasons for it.
I mean, I want to, at least this was news to me. I didn't know that I could possibly go get all my healthcare records. Because I got my blood result that was mailed to me because I was doing all kinds of work and they wanted to test everything. But I don't know if any of you seen those blood work sheets. Only a doctor can read them. There's no way. I got it and I was like, okay, what am I seeing here? The reason was my doctor circled something and just said, put a smiley face in it. It's all good. And I was like, okay, that sounds good. But can you please explain to me what this is? Why is there a smiley face next to that number? So, of course, I know, given that I come from the world of startups and, where user experience and kind of demystifying some of this data and can be shown in a much more intuitive format. So there's a lot of innovation possible. At least, I'm probably, maybe I'm poking the wrong things here, but end of the day, doctors are supposed to be your guide. And of course now it's doctors hold all the keys. They also say, oh, maybe I shouldn't tell you this. And I'm like, no, tell me everything because I want to know what's going on really. So in that regard, how do you see, of course you all are individuals, you have your own personal data. How do you see this kind of innovation impacting healthcare? You're already doing something about it, but
and you mean in terms of data access?
Data access, I mean,
I absolutely think just in so many ways, both in terms of access for the healthcare professionals. A lot of what he's been describing here is, I mean, I worked also pre that era, remarkably short while ago. I mean, I could not see if my patient had gone to a heart specialist even in Reykjavik. I wouldn't see any of those notes, so I would have to rely on the memory of the patient, and so it's just ridiculous. But so that's a huge difference now to have access to all that as a professional. As an individual, I think that's absolutely gonna make a difference. But I do think your point on there's a layer needed in between to make it interpretable and actionable. Also keeping in mind